Good day everyone, Michael here again for the opening of April Corner episode 4. I believe all of you have experienced a wonderful week with us on advocating MMR issue on our social media. With this video, we are going to widen up our campaign by raising more awareness about how a pharmacy can contribute MMR in our community and further tackle with it in the upcoming future. We vision our members can get to know more about the role of pharmacists in this area and develop our professionalism. Let's look forward to the next April Corner video. IPSF APRO always brings you something fresh and unexpected surprise. So let's talk about the actions. So could I know what interventions we have already been used to resolve MMR at this day?
So the actions we can take are quite clearly defined. I think let me first start with actions that every single individual can take. So people watching this video can take. First of all, I would like to make sure we actually don't have to resort to antibiotics in the first place. Because for many illnesses, we don't actually need antibiotics. So that's very important. And how can we best prevent illness? Make sure you get your vaccines. It's a very simple, effective intervention. Also, infection control. Make sure you wash your hands properly. Practice proper infection control at home, with your workplace, with your children. Very important. So at least that's a very key intervention we can make for people not having to use antibiotics. Of course, when people do get sick, we need to make sure we have antibiotics available. And there, actions we can take, make sure that when you have an illness, go and see a doctor and try to get properly examined through a laboratory testing that we can find out actually which kind of illness you have and whether we can actually prescribe the right antibiotic. That's very important. So prescribing the right antibiotic is also very important, and that is of course an action that involves our clinicians and also with the help of course of our pharmacists. That's very important. And at a broader scale, it is also still very important for our members to understand better antimicrobial resistance.
So if we look regarding the role of the pharmacist in this area, so could I know how a pharmacy can contribute to overcome MMR?
Sure, I think pharmacies are key actors in the fight against MMR. Why? Because often pharmacists are the interface, the direct contact between the patient and the antibiotics. So if we can make sure that pharmacists, whenever they're in contact with patients, at least make sure that when the patients request for an antibiotic, make sure they see the prescription, make sure they fill the prescription properly. And also what we see sometimes in countries is people have a prescription, but then pharmacists don't actually take it, and so people come multiple times with the same prescription. So what we can also advise pharmacists is make sure that prescription when it's filled, make sure they take it so that people cannot come back with the same prescription over and over. So also I think there's a clear role for pharmacists to play in advising patients. They can help to advise patients to promote safe use of antibiotics, make sure that they take antibiotics for their full course, and make sure also to give the right antibiotic as much as possible. And importantly, of course, push back if there is no prescription. That's very important.
So we have already know the important role of a pharmacy in this area. So as us, we are the pharmacy students and also the future pharmacists. So could I know what you like to see the movement and also the initiative from our pharmacy students to contribute to this area?
Sure, I think pharmacy students are very important. And why are they important is because you are at the forefront of the new knowledge that you gain from the universities, and you also have had the latest sort of training on how to use it. And I think if pharmacy students from a young age when they enter sort of like the pharmacy workforce apply proper practices such as like pushing back on when there's no prescription, making sure advising properly if they're in a hospital setting as a chief pharmacist advising and working together as part of a stewardship program with their doctors, they can really play a key role. And so I can only encourage you as pharmacists is like learn more about AMR and learn more about how you can play a role. And I think we talked a little bit about what pharmacy students can do. And again, I think you are also young people. You're in tune with like what's happening on social media, what's happening with young people. And so try to bring that sort of like knowledge also into like the way how you go about your profession. And so the knowledge is power, as we all know. And so if we can, from a very early age, like advise people in the right way, we know that like that will go a long way towards combating it.
Okay, really thanks Dr. Manu to share with us this really grateful information, and also I'm sure our members have already got lots of the fair knowledge about MMR. So like, thanks again Dr. Manu to have this video.
Thank you so much. Thanks. Bye-bye.
Bye.
Thanks.